For every one patient confirmed positive by testing for a coronavirus, there are 5 to 10 other undetected infections. Each of these 5 to 10 poses a risk to you and your families since they may have few, if any, signs of illness. Although these individuals are half as infectious as confirmed cases, they are responsible for nearly 80% of new cases. Kids infecting grandparents. The most vulnerable patients are over 70 and have diseases such as diabetes and high blood pressure. Their greatest risk of infection may be their own children or grandchildren, who may be silent carriers and have much greater social exposure to the virus. Full ICUs. Acute respiratory distress syndrome requires fast access to technical ventilators to breathe for the patient. In New York, Boston, Washington state, hospitals are quickly reaching full capacity. London had only 7 ventilators left for the entire city. Patients progress in as little as 8 hours from shortness of breath to respiratory failure. There's nothing more frightening than being unable to breathe and finding there are not enough ventilators for you. Healthcare rationing. In Italy, sick older patients are turned away and died at home for lack of ICU beds. Even in the early days, one patient per hour was dying in New York City. Doctors may soon have to triage to these patients with the best possible chance of surviving and who have young children in their families. U.S. hospitals are writing protocols to determine who lives and who dies. Mass graves. The epidemic is so severe in Iran that satellite pictures of mass graves have been sighted. Iran heeded few warnings and suffered an exceedingly high death roll. Failed testing. The Director General of the World Health Organization articulated that testing every possible case, isolating and treating them, was the only way to beat the pandemic. This is what the Chinese have done. This approach to testing in the US, the UK, and Italy has failed. Rapid spread. 70 of the original 92 cases in Boston came from one single company meeting at Boston's Long Wharf Hotel among Biogen executives and their guests. Within weeks, Boston became one of the biggest national hotspots, showing the infectiousness of the virus. Exponential. The number of new infections increases at an exponential rate, which may quickly overwhelm any health system. Conflict. Wealthy New Yorkers evacuated to the Hamptons, where locals complained they bought up many essential groceries and overwhelmed the local healthcare facilities. Bostonians are fleeing to Cape Cod, Nantucket, Vermont, and New Hampshire. One of the worst behaviors seen in the epidemic is hoarding. Here are store shelves around Boston. Those from high-risk areas like Boston and New York went to resort towns like Nantucket and Stowe, Vermont, emptying their shelves and perhaps bringing the virus with them, putting local populations at risk.